Hello everyone, welcome to GoTarryn TV. I'm Tarryn the Traveling Trainer of GoTarryn Personal Training here in the greater Atlanta area, about to welcome for the very first time a new guest to the show, Mr. Jason Pon, right here on GoTarryn TV. Now before we interview Jason, I'd like to invite everyone out there to please make sure to subscribe to my YouTube channel, and while you're at it, if you'd like the video, leave us a comment and share it with all of your friends and family out there. Now I'm specifically here on set in Buckhead today at the Second Ponce de Leon Baptist Church in Buckhead, and the reason I am is because this is one of the places that you can find Mr. Jason Pon, who offers biomechanical muscle stimulation. Now, what in the world is biomechanical muscle stimulation, you may ask? Hey, don't feel bad, I asked the same question. And I found out firsthand when I jumped on the table and he was able to introduce me to this machine that offers stress reduction, and it increases flexibility, it makes you feel good, and overall it gives you total relaxation. And that's what he's going to tell us today for the very first time right here on GoTarryn TV. So we're in for a treat, and this is something new and something exciting, and he's introducing it right here to Atlanta and right here to you. So don't go away. Come back. We're going to be here with Mr. Jason Pon. And remember, with GoTarryn TV and GoTarryn Personal Training, it's your time, it's your investment, it's your life. We'll be right back. And welcome back. We are back here for the very first time side by side. As you could tell, Mr. Jason Pon joining us from here in Atlanta. Jason, how are you doing out there today?
Good, Tarryn. How you doing?
Very good, thank you. Jason, before we get going here, and the reason why we brought you on here again for the first time to get to know and get to meet you, that's exactly what I wanted to just do for the first few minutes here, and just kind of get to know a little bit about yourself, your introduction to your background, and just please tell the people out there a little bit about yourself.
Yeah, first and foremost, I want to say thanks for having me on here. It's really great.
Our pleasure. Thank you.
Yeah, so my background, I guess you could say, is I've always had a heart and passion to really just help others and to move and feel better.
Yeah.
And my journey basically started out about 5 years ago. I was personal training certified. I used to do personal training back in the day.
Cool.
And I worked with alongside a chiropractor for about a year as her exercise therapist. So I guess you can title me as a physical therapist assistant, as they would be a physical therapist, but I was a CPA, which is chiropractor's assistant.
Okay.
And yeah, and so I started realizing real fast like where I wanted to go, where my path was about a little bit over 4 years ago now. And I saw about 30 to 35 of her patients a day.
Oh wow! Oh my God!
It was a lot.
Yeah.
Yeah,
wow.
and it was a lot, and it was like in a 10-hour workday, and every patient had different modalities, whether it was neck pain, sciatica, foot pain, because we used to use it's called like an Arconia laser, and it's called like low laser light therapy. And so then I started like paying attention to her business model, how she did things and everything. And then I decided to just make the leap and moved to Georgia for personal training specifically. And I got into pain management because I was trying to look for other chiropractors to work alongside them to help their patients excel. But the sad thing is a lot of them didn't do what she did with me in her clinic in Mississippi.
Uh-huh.
And so then I decided to branch off on my own and worked privately on my own, and I got some clients and everything. And so that's basically the nutshell of the background, just personal training and which is a chiropractor's assistant mainly. And I'm originally from California, and I moved here from there to Mississippi to here about a little under 3 years ago. So it's quite...
Wow.
Yeah, I keep coming more east.
Yeah, you are. You're working your way over. Finally made it here. So back up in California. Where in California were you from then originally?
Yeah, so I'm originally from Northern California. So it's a city called Yuba City, California, but it's about 45 minutes north of Sacramento.
Okay. So
it's almost So if you almost look at the map of California, it's almost in the dead center of California itself, actually.
Very nice. I've been to Sacramento and Redding. I think it's beautiful out there. And then, in Mississippi, what parts did you live in there?
I was there in Biloxi and Ocean Springs area, so right on the coastline.
That I love that area. I've got a really good friend who lives out in Gulfport, not too far from there. So
Oh
I
yeah,
know
yeah, yeah,
I know Biloxi very well, Jason. I've spent a
yeah.
lot of time at that Hard Rock Casino there in Biloxi. That's fun.
Yep.
Saw a
As
lot of
do a lot of people. Yeah,
yes,
because
definitely.
that's yeah, because I think that's the nearest Las Vegas to people in this area, if
You're
you want
right.
to categorize it that. But it's like very small. But
Yeah. No, you're absolutely right. Jason, have you been to Atlanta before, or what brought you here? And besides, coming here for work and for personal training, but what were you attracted to about Atlanta?
yeah, so I met some really good friends in Mississippi, and I was living with my sister and brother-in-law at the time. He's Air Force, my brother-in-law, and they moved to Germany.
Oh,
And
wow.
then, yeah, they gave me the opportunity to go over there with them, and I would work on the Air Force base to maintain residency, I guess you could say,
Yeah.
or or like a small, like short-term working visa, if you will.
Yeah.
And I had that option, or I was like, it's either go there or stay. And so I decided to stay. And sure enough, I ended up moving to Georgia about a year and a half later after they left. And my friends lived here, and they were telling me, the market for personal training is better here. Just come stay with us and go from there. And so I just decided to just pack up my stuff and go.
Oh,
So
wow.
yeah, so I'm a huge risk taker,
Yeah, I could tell. I mean, that's
big
great.
time.
Well, it's
Yep.
working out tremendously for you so far, and that's
Yeah.
terrific. And so now here we are, Jason. Today, for the topic, I was going to ask you specifically because I have not heard about biomechanical muscle stimulation. You're the very first person to introduce it to me,
Yeah.
and I've never seen the machine that you brought into the Family Life Center in Buckhead here, and so I'm really interested in. And for those people watching out there, by the way, I've been on the machine itself, so I can give my own personal testimonial too, but. I
Yeah.
guess you first, please, Jason. Tell us about what is biomechanical muscle stimulation for the folks who might not know what it is out there.
Yeah. So biomechanical muscle stimulation, I guess I'll just give the overall history and build it up if that sounds good.
Sure, please. Yeah.
So the theory of mechanically stimulated muscles started in the early 1930s,
Mm-hmm.
and I forgot the doctor's name. I can get it to you later, but I do know the guy that took over it in 1970,
Mm-hmm.
and his name is Dr. Vladimir Nazarov.
Mm-hmm.
And so he was a Russian scientist, and his theory was that as if they've been essentially worked out, they would increase strength and flexibility. So they use this same technology in their NASA program. That machine they have in Second Ponce that you stand on and it does this?
Yes, right,
Right?
exactly.
So they used a very similar machine for their NASA program, but it had a different motion to it.
Mm-hmm.
And they were actually able to versus the United States was able to stay in space for 120 days because their whole theory and goal was to minimize as much muscle loss as possible
Mm-hmm.
while in space.
Wow. And
So yeah. Go ahead.
yeah, no, that's fascinating because again, I'll be honest with you. What is the name of the machine you just referenced it, the Second Ponce that they have? Because I never even knew what the machine name is of it myself.
I honestly don't even know the name of it. All I know is it's a standing vibration machine, is what they call it.
Right,
And
right.
with those that are made in the U.S., there's not a lot of. There's some things out there about it,
Mm-hmm.
but a lot of those things is a huge hit and miss because
okay.
you don't really know if you're not familiar with the motion, the vibration,
Right.
everything else. Like you can actually do more harm than good. And I've actually ran into a few people there that actually have knee replacements, and I told them, I was like, this is not a good idea for you to do.
Oh, wow.
Yeah, and so they're like, okay, I'll just stop their hands, like use the mechanism that I have. I was just talking to them because they were asking me what the difference was.
Yeah.
But yeah, so generally you don't. If you have metal replacement knees or hips, you generally wouldn't. It's not just recommended because it just doesn't feel good. Just as I wouldn't put someone that has metal in their spine,
Sure.
I wouldn't lay them on the back on the mechanism that I have either.
Oh,
so it's just
yeah.
So it's just kind of like I guess you just always exercise caution, but also use common sense at the same time.
Wow.
For sure.
Oh,
Yeah.
yeah. Gosh. And then what about
Yeah.
the name of the device that you have, Jason, your machine?
Yeah, so the name of the device of mine is called the Rickian Exerciser,
Mm-hmm.
and his theory was that if you can stimulate the paraspinal muscles,
Uh-huh.
they would basically you reduce the tension in the paraspinals, because his theory is like everyone runs around as if they're stressed. You got too much tension, more tension on one side, lack of tension on the other. And the more, because I've been doing this a little under 2 years now.
Mm-hmm.
2 years will be this October. Yeah, 2 years will be this October. And it's one of those things with his theory. It's really hard to argue with, because when you feel someone's tension in their lower back,
Mm-hmm.
and you measure their arms and you measure their legs and pelvis and their feet,
Right.
it's one of those things where everyone is predominantly more tense on one side, and so the machine's job through the pumping effect is to reduce the muscle's tension, restoring proper paraspinal alignment, because your paraspinal muscles are what's responsible for maintaining posture.
Oh, right. Right, of course.
Yeah.
Of course.
Yep.
Interesting. Wow. And I know we're going to insert some overlay video clips of it too. While we do that, can you tell us a little bit about what people are seeing when they see this quick vibration that you speak of too, please?
Like, what are they seeing, like, visibly?
Yeah. Explain what's going on, I guess, for the folks who might not understand. What are the benefits and what's going on physiologically in their legs, back?
So the motion, it produces a vertical circular motion, kind of like this, kind of like think of like an elliptical, right?
Yeah.
And so what it's going to do to the muscle fibers is it's going to compress, stretch, and release the muscle fibers 1,000 times per minute. So what's interesting though is I'm still a new student in BMS myself, because a lot of the articles they have about it is in Russian and in German, and it's a hard Google find search. But I found like at least, I think I'm up to like 8 to 10 articles on it now about everything, and so there's like a lot of substantial info on it. But then Nazarov wrote books about it in German and in Russian, and I need to find some translators to help me with that. But yeah, so what the benefits with it through that circular motion is you're going to improve blood circulation.
Yes.
You're going to essentially detoxify the body.
Mm-hmm.
You're going to maximize flexibility and range of motion. And then I met with one of my friends that's a pathologist, and he was telling me that you're getting the benefits of local circulation, where you're going to increase and help venous drainage and lymphatic drainage as well.
Okay.
Yeah. If that paints a picture. So
yeah,
it's very, people have told me like, oh, it's like a massage. I'm like, it kind of is, but it kind of isn't, because a massage therapist needs the muscle like this, right, and so which is great and all, but if you're wanting more by pure mechanical means, if you're wanting the benefits of increasing circulation, getting flexible, maximizing range of motion, then BMS is really the way to go.
Yeah.
Speaking. But the other side to this is that you get to keep your clothes on. So that's the other cool part about it, is you don't need to undress anything. You can even wear jeans. You can wear khakis, like whatever you want.
Yeah.
So.
Jason, what I liked about it is that it was very comfortable feeling, because personally, I thought that it almost felt like a real massage, and I did feel better too after I was done with it, just my little brief experience on it, and I thought that was really neat. So what can you tell the folks out there what they might experience if they share, I guess, those same feelings of benefits and overall health and wellness for them when they're doing it?
Yeah, so it works. So basically, it kind of, if you think in terms of, so you have your repetitive cycle for the pain cycle. You have pain, reduce motion, reduce circulation, inflammation, reduce movement.
Yes.
So the machine's job is reverse that effect by pure mechanical means, because each time someone does their back muscles, they're going to notice an instant result of 10 to 15% softer and looser muscles. So generally, I would say majority of the people that I see, want your it was explained to me by the retired chiropractor guy that designed this, was that you kind of want your muscles soft, which
Okay.
would signify you have minimal to no tension, right?
Okay.
So
Yeah.
so you want those paraspinals to feel like cookie dough initially. And so I kind of joke around with people. I was like, oh, well, these muscles are supposed to feel like cookie dough. It feels like your cookie dough's been left out for 12 hours. Then that registers in their mind like, oh, that's pretty hard. It's
Oh,
like,
yeah.
yeah, it is. And so basically, like I said, when you do your back muscles, you can experience 10 to 15% softer, looser muscle, more range of motion.
Okay. Okay.
Right
That's
out of the gate.
tremendous. Oh, that's impressive.
Yep.
Wow.
Mm-hmm.
Wow. And
So for example, someone that can't touch their toes,
Uh-huh.
like if they're about maybe 6 to 8 inches far from the floor, please touch their toes or put their fingertips or their second knuckle on the floor within just 10 minutes of stretching on it.
Oh, wow. Wow. That's so beneficial. And, going back to, the question of who needs this therapy too, that's kind of a general question, but who would you urge to, seek out this therapy and have this service provided to?
Yeah, so basically my answer to that is anybody's a great candidate for it.
Yeah.
The only thing that you want to consider is if you come and see me, if you have any metal rods in your body, just let me know.
Yeah.
But if you do have metal in your spine, there's not much I can do for you just because you don't want to mess with any of that at all.
That makes sense.
Because the machine, it works all strictly muscles, but it doesn't do bones. But generally my main clientele that comes see me is for pain management. One of your clients actually is seeing me for pain management, but also to get flexible fast.
Excellent.
So it does the best of all the different best worlds, from pain management to flexibility. But I tell people as a rule of thumb, you can never have enough blood circulation. So, just because the guys that designed and thought about the theories behind this technology, they even say that yoga, exercising is good, but it's still not enough. You need that mechanical stimulation of muscles to basically pump. Because if you think about it, life is in the blood, right?
Oh, yeah. Mm-hmm.
Right? So if you get maximized pumping effect into those muscles, I mean, you're just going to move and feel much better right out of the gate already.
Yeah, very true. No, you're right. No, that's a good point. So that's excellent, Jason. You've talked about stress management with it and the help of blood circulation just now, and of course muscle tension and flexibility. How about talk about the toxin elimination too? That's another thing that we didn't touch on as well.
Yeah. So basically, I almost partnered with a German doctor in Germany.
Yeah.
And so I had to have a translator to meet with him because they wanted me to sell their handheld device of BMS here in the U.S. And he looked at the table online and he said, you have a great detoxifying table. So basically you have, lymph nodes all over your body, which is, lymphatic system.
Oh, yeah.
So when there's, I wish I would have sent you that one video of the water, because there's water in a pan that I did a video on, and it shows the circulatory effect of what the water does on the mechanism. Yeah. But anyway, so basically what everyone will see when you post those pumping effect videos is you're basically getting that local circulation in the area that you're specifically targeting. So you have your cells within the muscles and everything, and so what happens is I met with a biochemist as well, and he even said, to reiterate, that when you're on the mechanism, you're moving and stretching the cell. So you're getting adequate nutrients and oxygen to the cell while you're pulling the bad metabolic waste out of the cell.
Okay, I see.
Does that make sense?
Yeah, that's very interesting. Yeah.
Yeah. So people have told me, hey, is your machine hot or is it just me? I'm like, no, it's just you. And that tells me that their body was able to reach that cellular metabolism level, because what happens under normal vibration is it just compresses the cell initially, but with BMS, it compresses and expands the cell.
Oh, wow. Huh.
Does that make sense?
Yeah, totally. That's amazing. Wow.
Yeah. So it has like like optimal benefits for just about anyone. But generally, you know, I tell people like, oh, like, because if someone does like a 20 to 30-minute session, I tell them right out of the gate, I was like, you need to hydrate because you're pushing a lot of stuff around your body. You're going to want to hydrate a lot.
Yeah.
So,
Yeah.
you know, so, but does that, is that good?
Yeah. Oh, that's terrific, Jason. Oh, good
Okay.
explanation. And then, you know, I keep spreading the word to my clients, and we've got some that are definitely seeing you. For example,
Yeah.
John, he comes several
Yeah.
times a week. How many times a week? Is there a recommendation that you would say, you know, generally speaking, for how many, you know, sessions and how long would you recommend in terms of like how frequent and how long of a duration they should stay for?
Yeah. So the general rule of thumb is when you're talking about muscle tension in the paraspinal muscles,
Yeah.
that's more of a severe thing because people that are seeing me that have that
Okay.
chronic, they're going to want to do it a minimum of 2 to a max 3 times a week for the
Oh, okay.
first 4 to 6 weeks, just because you're trying to reduce all that tension in that area.
Mm-hmm.
And you're just, so if you think about it, that one side is full of tension. So
Mm-hmm.
along the spine, if this is the paraspinal muscles, my hand's the spine, right?
Mm-hmm.
For example.
Oh, yeah.
So if this is all tight, you have limited circulation along the spine. So what happens is the nutrients and hydration of the discs are minimalized due to the tension.
Mm-hmm.
So the way it was explained to me by the retired chiropractor is that when you have tension along the spine, you are definitely at risk for a herniated disc or a bulging disc because there's no circulatory flow along that area. So the machine's job is to come in with that pumping effect, reducing tension, enhancing circulation. Then people would come off the table and say, wow, like that's a big difference. Like I can move more without pain.
That's wonderful, Jason.
So that's why it's crucial, and it varies from person to person. Like someone might have minimal tension, like you have minimal tension.
Yep.
So I would say, Tarryn, you're good with doing once a week or once every other week, bud. Like there's no problems here. But someone that has rock hard, like 12-hour left out of the fridge cookie dough muscles, you're gonna want to do it at least 2 or 3 times a week. And normally it takes about 2 weeks to the first month to see significant noticeable results. So,
Yeah.
you know, and it has multiple attachments. I can do the feet. If you're having tight calves or ankles, it can help with that. I can do the calves, the hamstrings, the quads, IT bands, psoas, hip flexors, the shoulder, the neck.
Everything.
It can pretty much do, yeah, I can do pretty much anything I want to do. And I do, and if I can actually share 2 stories real quick,
Please.
that I think would help paint a picture for everybody.
Oh, yeah.
So my first best story is I work with this lady. I think it was about a little under 2 years ago, because I've had the table almost 2 years. So she actually had a stroke 20 years ago.
Okay.
So she had paralysis on the left side of her body, so she couldn't feel anyone touch her on her left side.
Oh,
So that
wow.
side was just straight paralysis, like just basically limp.
Mm-hmm.
So I set the tops on that I showed you for the back muscles. I set those up on the left side to stimulate the right side of her brain. And I wasn't really, to be honest with you, I wasn't expecting the result that she had her first session, but she did her back muscles for 20 minutes. And she can move her arm like this.
Oh, wow. Oh, that's awesome.
Yeah, so it was still stuck.
Yeah.
But she can move and feel up here for the first time. And when because we had our grand opening for the fitness center I was a part of at the time with the table, and there was a lot of people in the room, and I was like, guys, I gotta leave because it was so emotional, because this woman had straight paralysis for 20 years, and she said she's tried everything.
Wow.
And the best way I can explain what the table did is it connects to the autonomic nervous system of the spinal ganglia, and it basically stimulated and reawakened her nervous system.
Wow.
And I see people that have some sort of like shoulder issue or frozen shoulder, and I share that with them, and I'm like, look, if this can help someone that's had paralysis for 20 years, there's no reason this can't help you. Like there's no reason.
What a cool story. Wow.
Oh yeah, most definitely. So I still haven't really tested it yet on Parkinson's disease, but I have experienced it with edema before and a sprained ankle. And in
Okay.
both cases, I would just do the calves. So this guy came in and saw me, sprained his ankle that Saturday. I said, come see me on Wednesday. And so I did his calves for 20 minutes. And through that circulatory effect, the swelling went down 80%.
Oh my God. Wow.
Yeah. So from an athletic standpoint, when I meet with athletes, I tell them this is injury preventative for you, because it's going to help you move more efficiently and be more flexible, because as you know, the more flexible you are, the less prone to injury you're going to be.
Oh yeah. Yeah, totally.
But also, if you have an injury, it'll speed up the recovery time because of that pumping effect.
That makes sense. Huh.
Yeah.
Wow.
So those are my two, good main stories and everything. I mean, it's really one of those things, like I was explaining to someone, a few members at Second Ponce, that want to like dialogue more about it, then get more in depth, kind of like how we are.
Oh yeah.
I tell them as a rule of thumb, I was like, look, nowadays you have all these things being created, designed, but a lot of them have pros, a lot of them have cons. And I tell them, I was like, it's very rare that you have a product created or designed that has minimal to no cons. And so the rule of thumb for me is like, this can help just about anyone, from pain management, from an athlete to my oldest client now is a 93-year-old that just wants to move better. So it's designed for everyone, generally, as a whole. The way this table is designed is for your normal person.
Oh, that's excellent, Jason. Yeah, and that's fascinating. Great stories there. Just with those two stories alone, that's got to make it all the more rewarding. That's just so incredible and amazing to hear. And before we wrap it up here, Jason, this has been a really great 30 minutes talking to you here and getting to know you and more about biomechanical muscle stimulation. A couple more questions for you.
Sure.
One is obvious. It's great for everyone. We know that. Any great candidate. But how about yourself? Do you get a chance to get on there?
I do.
Okay,
I do.
Good.
I try. Yeah, I try to use it whenever I can, whenever there's time. So, and it's one of those things, like, as you know, as a trainer, you just listen to your body, and you know what you need to do, right?
Yeah.
So for me, like, sometimes I'll do my hamstrings and everything too. Sometimes I'll do my hip flexors, because if you sit a lot, you're going to generate tight hips.
Oh yeah.
So yeah, I generally try to do it as much and as often as I can, because my body holds tension and stress just like everyone else's.
Yeah.
And so, I can definitely say, like, just having it and everything, it definitely, like, for me, my first actual time on there, true story, the guy set it up and he gave me a full back column, which we don't do on someone's first session, but he did it for me because it's like, oh, you're young, you'll be fine. And this guy's like 75 years old, mind you, so he's just like, oh, you're young, you'll be fine. I was like, okay. So I kind of, I don't want to say I threw my back out, but I hurt it doing kettlebell swings because I overhinged my hips. And so my lower back did this.
Oh yeah.
So I overextended it. So, and it never quite fully healed. So when I was on the table the first time,
oh yeah,
it kind of was like a little bit like, ooh, like, ow, a little bit. But after 3 minutes, the pain went away and I was able to just relax into it. And the feeling, like, when it shuts off, it's like this, it's like think of like a waterfall being like released, like that flush feeling. That's the feeling you feel when it shuts off, whether you're doing your legs or your back muscles, your feet. It doesn't matter what muscle you're doing. You feel that flush release, and it's quite exhilarating. Because I think you remember that.
Yeah. Oh, definitely.
Yeah.
Oh yeah.
So
yeah, I could relate to that. Definitely.
Yeah. So, but yeah, I try to use it as often as I can.
Perfect. That's awesome, Jason. And well, again, this has been great to get to know more about this BMS, and then also obviously get you out there not only at Family Life Center in Second Ponce, but also some other places like Georgia State and some other places as well. So we'll definitely chat. Yeah, let's talk about that as well. But before we let you go, last question, Jason. So anybody who is a member of Second Ponce, if they're watching, or anybody that wants to know more information, what's your best contact methods that they can reach out and directly contact you?
Yeah, so I have a Facebook page, a business Facebook page. They can go to it. It's called Feel Rejuvenated Inc. They can search for that, and then there's a bunch of articles about the technology on there, actually.
Oh, good. Okay.
They can also contact me through my cell phone number, area code 530-844-2483.
Perfect. Okay, and we'll have that up when we fade to black. We'll put that on the screen so everybody can have that.
Awesome.
Excellent, Jason. Well, very well said. Thank you so much for your time. This has been a great half hour, and really enjoyed talking to you and learning more. And definitely like to have you back on too in the very near future and do another one.
Yeah, no, that'd be great.
It's a lot of fun.
And I think a good thing would be if you wanted to explore this, we can talk about the art of personal training.
Let's do that next time. I love it. That's a good topic next time. Yeah.
I think that's something that is kind of, needed and crucial, because I'm sure you've walked into a gym, for example, and you've seen a trainer on their phone and right in front of the client.
Oh yeah, absolutely.
And so for me, it's like a lot of clients just don't know what personal training is really all about.
Oh yeah. Yeah, that'll be a very fun episode. That'll be a fascinating one for sure.
Yeah, I'm sure we could talk for hours.
We both can have some stories. We'll fill up 30 minutes like that too.
Exactly.
Well, Jason, thank you so much. Enjoy the rest of your day. And as we fade to black, here comes your contact information right now for everybody.
Okay, great. Well, thanks, Tarryn. Thanks for having me. Bye, guys.